Your Health Watch leads. Inclusion for All, IFA, Action Hub Update. 1st of March 2023. Hashtag leads inclusion for all. Hashtag accessible information standard. Introduction. Accessible Information Standard implementation is central to reducing health inequalities and providing equal access and outcomes for people with additional communication needs. The Hub has gathered information about and presented the challenges facing people with additional communication needs over the last 3 years. It has also enabled professionals and people with lived experience to co-produce some of the solutions. However, people continue to share frustrating experiences with us when their communication needs are not met. We have featured 4 lived experiences to highlight the barriers people are facing. This is presented in a YouTube video titled Spotlight on Accessible Information Standards in Leeds, January 2023, which can be accessed via the following web address: https://youtu.be/lowercase I, capital D, capital T, the number 9, lowercase v, lowercase I, lowercase h, lowercase d, lowercase b, capital W, lowercase g. Building on the commitment which the Health and Wellbeing Board made in the June 2022 workshop, the Hub was invited to conduct a second session which focused on identifying actions related to the AIS in January 2023. Key themes of challenges. We shared our findings that the key challenges around implementing AIS were IT systems, the need for a system to record and flag patients' additional communication needs and details of how these needs should be met. Process, staff training, and a consistent template used across health and care organisations. Wider system. Information about patients' communication and information needs should be shared across NHS and social care providers with people's consent. Outcome of the HWB workshop. Number 1. Person-Centred Care Advisory Group, chaired by Jim Barwick, to be accountable for AIS implementation. Number 2. Leeds Health and Care Academy to look at deaf awareness training for all organisations. Number 3. AIS to return to the board in 6 months for an update on progress. Jim Barwick and Lucy Jackson. Further actions from the IFA Hub. Number 1. Developing AIS training e-modules with RNIB and NHS England. This is to contribute our expertise and existing training material to NHS England's AIS e-learning modules for NHS staff and civil servants. Number 2. Raising awareness of people's right to ask for support to meet their additional communication needs. A video to be produced and uploaded to all GP practices' TV screens. Number 3. Influencing commissioners regarding AIS. Write to commissioners at West Yorkshire Integrated Care Board to ensure that contracting and performance management arrangements include AIS. Number 4. Improve GP access. Sharing good practice and learning from our work improving GP access amongst the primary care networks, especially for patients with communication barriers, based on the needs of the sensory impairment, learning disability, and neurodivergent communities. Please note that the Hub won't meet until September, after the 6-month progress update from Jim and Lucy to the HWB, when we will decide on further action.